My name is Fatima Takaki. I'm a nursing student from Montgomery College. I'm here to do your physical assessment. Is that okay? Yes. Provide privacy, perform hand hygiene. Identify the patient using two identifiers, name and date of birth, to make sure you have the right patient. Okay. So while I'm assessing the patient, whilst I'm identifying the patient, I'm also checking for the patient's orientation level. Where are you? What's your name, date of birth? Where are you? Why are you here? Who is the president? So the patient is alert and oriented times 4. Okay, so what's your chief complaint for today? Back pain. How long have you been having this pain? For like a week now. Where's the pain located? Is it in your upper back, lower back? Where exactly? The pain is located on my lower back. Do you have any alleviating or aggravating factor for this pain? Yes, when I'm walking it's more aggravating, but when I'm laying down it's a little bit better. What have you been taking for the pain? I've been taking some Advil. Has it been really helping? Yeah, a little bit, but it just keeps coming back, so I decided to come here. Okay. Is it a sharp pain, dull pain, throbbing pain? How can you describe your pain? It's a sharp pain on my lower back. Okay. On a scale of 1 to 10, how would you rate your pain right now? 10. 5, sorry. On a scale of 1 to 10, I will rate my pain as a 5. Okay, that's moderate. Have you taken anything for the pain right now? Yes, I just took total enough before coming here. Okay. So I'm going to start with your assessment. I'll be assessing you from your head to your toe. If at any point you feel uncomfortable or have any pain, just let me know so we can stop. Okay. Before you start with the assessment, you go to the head, check the scalp for any sclera. Before I start with the head, I'm going to put on my gloves first, just in case if you come with any body opening. Okay, no sclera, no lesion, no baldness, even hair distribution on the head. The hair is nicely distributed on the head. Okay, and the head is nice and round and symmetry. Okay, then I'm going to check the eyes. Yes, let me go with the eyes. I'm going to check the eyes. The eyebrows are nice and lined. The eye is symmetry and in line with it's nice and lined. It's in line with the ear like it's supposed to be. It's in the middle, and the eyelashes are present. The sclera is white. Okay, so I'm going to check cranial nerve 3, 4 and 6. Cranial nerve 3, 4 and 6. So I'm going to use where's my pen light? Okay, right here. So I'm going to use this pen light. I'm going to check for accommodation, reaction to light, pupil dilate, and all that stuff. Okay, so keep your eye on the pen and move your eye when the pen moves. Don't turn your neck, don't turn your whole head, just your eye. Okay, then I'm going to check the pupil for dilation. Okay. Okay, the pupil dilates equally to light. Then I'm going to check for accommodation. Keep your eye on this pen, okay? Don't move your eye, just keep your eye, keep looking at the pen as I'm bringing the pen closer to your eyes. Yes, the eye, all that is good. The accommodation is okay, reaction and all that, the eye movement is good. So I'm going to check for the snelling. I'm going to do the snelling test. Okay, you're going to look at this and tell me the numbers. Okay, the snelling chart is good. The patient's vision is 20/20, nice. Okay, now I'm going to assess the nose. Check the nose, the symmetry. The nose is nice and straight, and it's symmetry. Check inside the nose for any drainage. No, it's nice and moist and pink. No drainage from the nose. I'm going to assess cranial nerve number 1. Okay, so you're going to close your eyes. I'm going to spray something on my hand and ask you to tell me what it smells like. Okay, close your eyes for me. Can you tell me what you smell? That's a nice vanilla. Yes, that's a vanilla. So the cranial nerve number 1 is working. Okay, now I'm going to check the temporal artery. I'm going to assess for I'm going to assess the temporal artery bilaterally. Okay, I can feel the temporal artery now. I'm going to assess I'm going to palpate the sinuses. If you feel any pain, let me know. Okay, do you have any pain here and here also? Okay, good. Then I'm going to check the TMJ joint, which is located here. Okay, can you open once? Okay, can you clench your teeth for me? Okay, I can feel it clenching. So the TMJ joint is okay. I'm going to check cranial nerve number 7, which is the facial nerve. Okay, close your eyes for me, please, and tell me when you feel a sharp or dull. When you feel a sharp or dull sensation, what did you feel? Dull. Okay, what did you feel? Sharp. Okay, so the cranial nerve number 7. That is cranial nerve number 5. The cranial nerve number 5 is working. So cranial nerve number 7, which is the facial movement. Can you puff your cheek for me? Smile. Close your eyes. Squeeze your face. Okay, so the cranial nerve number 7 is working also. Then I'm going to check the mouth. Okay, the lips are nice and pink. Can I look at your teeth? Yes. Have you had any teeth removed? Have you removed any teeth? No. Okay, look at the tongue. Nice and pink, not beefy red. You look white, you look at the tongue, you look at the palate and the uvula. They all okay. Then you check for taste. Give the patient something. Have you lost any taste recently? No. So your taste bud is okay. Okay, so that's good. Now I'm going to check the ears. Check the ear is nice, and do you feel any pain there? No, they are nice and laying flat. Then I'm going to check in the ears for any drainage. Look in the ear, there is no drainage in both ears. They look good. Okay, then you're going to check for the cranial nerve 9 and 10, which is here for swallowing, and the neck movement. You palpate for the lymph also. Okay, can you swallow for me? Then whilst I'm here, I'm also looking for the trachea to make sure it's nice and straight, and the trachea is nice and straight and it's in the middle. Can you move your neck for me, left and right, please? Yes. Okay, so the neck movement is good. Then I'm going to do the next so now I'm going to check can we check do you have any difficulty breathing? No. Do you cough? Any sputum? No. When was your last mammogram? A couple months ago. Do you have any pain in your chest anywhere? No. Okay, so no pain. Are you sexually active? Yes. Check the skin. Check the skin for circulation. Make sure the skin color matches ethnicity. Okay, the skin is nice, no dryness. Now I'm going to auscultate the lungs. Okay, so I'll be using this doll to auscultate the lungs. Okay, so I'm going to do the anterior view first. Okay, then you check the lateral side, and then you check the back. Take a deep breath for me. Breathe in and out. Okay, no crackles in the lungs. The lung sounds clear. Okay, now do you have any chest pain? Do you have any pain? No pain in the chest. I did not notice any palpation. The patient is breathing normal. So I'm going to check the patient. I'm going to check the heart. Do you have any difficulty breathing? Trouble sleeping? No. Okay, let me check the heart. So I'm checking the aortic valve, pulmonic valve, heart point, tricuspid, and the mitral. Then I'm going to auscultate the apical pulse for a whole minute. Listen to the apical pulse for a whole minute. Okay. After that, then I'm gonna check the carotid artery. This one I will do one at a time, not together. And here, okay, it's here, and here. Okay, and I'm gonna check the radial pulse, which is here, both bilaterally. Do it together. Then you check the brachial together. Then you check the dorsal pedalis, which is here, posterior pedalis. Then you go to the anterior dorsalis. Here you palpate both together, both left and right legs together. Okay. The pulse are good. The pulse are good. Okay, I can feel the pulse and yeah. Okay, then I did not notice no visible pulsation, even here distribution on the legs and everywhere. Now I'm going to check for muscle strength. I'm going to check the muscle strength in the hand. Can you push against my hand? Can you pull? The patients have equal muscle strength in the upper right. Can you now I'm checking the muscle strength in the feet. Can you push? Can you pull? Equal muscle strength on the leg. Can you move your wrist? Can you move your neck also? Can you move your hip? Can you do your ankle for me? Okay. Okay. Nicely. So the patient can, that is good. Now I'm going to check for edema. The most easiest place to access for edema is on the ankle. So okay, no edema, the skin bounce right back. Then you're going to check this the nails for capillary refill in both fingers and toes. Okay, the patient has capillary refill. Check for the shape of the nails. The nails is round, not broad, and not yellow, nice and round. The nail is not bigger than the nail bed, so it's good. The skin color match, the ethnicity. Okay, that looks good. Okay, then you're gonna now I'm gonna check do you have any, when did you have your last do you have any constipation or diarrhea? No. When was your last bowel movement? This morning. When was your last menstrual cycle? 2 weeks ago. When last did you have a pap smear? 2 months ago. Are you sexually active? Do you have any problem urinating, like pain or irritation while you use the bathroom? No. Do you have excess? Do you do excess urination, especially at night? No. Do you have blood in your urine? No. Okay, so now I'm going to check for bowel sound. Okay. Okay. Right upper quadrant, lower upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. The bowel sound normal, no abnormal bowel sound. Then now I'm going to palpate the stomach lightly, and whilst I'm doing that, I'm also checking for any guarding and its contour, nice and round and flat. The umbilicus is in the middle and it's clean. No sign of infection or any drainage coming out of it. It's nice and clean and dry. Okay. So that's all for my assessments. Thank you for giving me the opportunity to work with you. Do you have any question for me? No. Okay. So take off my gloves, perform hand hygiene. Then I'm going to do my documentation. In the computer.